and good morning, good afternoon, and good evening, everyone. Welcome to another week of Global Café. My name is Elizabeth Lewis, and I'm a Senior Project and Policy Coordinator here at the IFA. And I'm very excited to be introducing you all to Dr. Pallavi Pant. Dr. Pallavi Pant is the head of the Global Health and Health Effects Institute. She has 15 years of experience and research in public engagement on air pollution and is particularly interested in low and middle income countries. She serves on the editorial board of Air Quality, Atmosphere and Health at the PLOS Global Health and chairs the governing board for OpenAQ. She holds a master's in environmental sciences from Terry School of Advanced Studies in India and a PhD in environmental health from the University of Birmingham in the UK. So as you can tell, Dr. Pant has accomplished much in her career, and we are very excited and honored to have her join us here at the IFA to discuss the impacts of air pollution on aging populations. So welcome, Dr. Pant. And before we speak about air pollution, I want to ask a bit more about yourself. As we can see from your biography, throughout your life, much of your work has centered on research and engagement in environmental science and air pollution. So my first question for you here today is, what ignited your passion in this field, and how did you get started?
Yes, thank you, Elizabeth. And first of all, thank you very much for giving me this opportunity to speak with all of you. I'm very excited about the next hour. I grew up in India and spent most of my formative years in New Delhi, which is India's capital, and also among the most polluted cities in the world to date. So, growing up with that, and not always knowing that this is air pollution, but knowing that often if you were outdoors for too long, you would start to feel a scratchiness in your throat, or you would start coughing, just led to an interest in what might be causing it. And then over the years, as I went through my undergraduate and master's programs in India, I slowly started focusing more on air pollution. I also realized that this is a problem that we can solve in our lifetime. So it seemed like a good area to be investing my time into.
Wonderful. Yeah, thank you for sharing a bit more. It's always interesting to talk to people who have that lived experience and how that informs their career choices. So thank you so much for sharing that. And I guess just to start us off as well, although our audience members are likely aware of climate change more generally, and the climate catastrophe, could you help set the stage for us all by explaining what exactly air pollution is and what the conversation around air pollution is like currently?
Yes, absolutely. Air pollution actually is a problem that is very old. We've
Mhm.
seen evidence from some of the earliest manuscripts on smoke in the air or haze in the air and, black particles. So
Mhm.
essentially, if you're thinking about air pollution, think of anything that is not really wanted in the air. Particles and gases that may be coming from other sources that are not natural. Most often, when we think about air pollution, we're talking about fine particulate matter or PM 2.5. I will refer to this very often in the next half an hour.
Good.
And essentially, what these fine particulate matter is referring to is really, really small particles that are often emitted when we burn things. So, if you're burning coal or if you're burning gas in our vehicles, if you're burning waste, in a neighborhood, or if we are also burning any kind of fuel in industries. So often it is these particles that are not visible to our eyes, so very difficult for us to see unless there's too many of them, and then suddenly they start to become visible, as well as other types of emissions that come out of these different sources. But primarily, anything that may be coming from combustion related sources. Some of the pollution also comes from things like just dust, because that's also something we can inhale and can cause some kind of health effect. So essentially, anything unwanted in the air, but oftentimes what we're talking about at the global scale is fine particulate matter or PM 2.5, which is related to a variety of health effects in humans.
Okay, wonderful. Thank you. Thank you for adding some context there. And I guess a follow-up question that comes to mind with me now is, What is the primary cause of air pollution? Is that sort of, is there a blanket statement that can be said, or is it different based on where you are geographically?
That is a good question. So, as I said, a lot of the air pollution comes from combustion or when we burn things, but the types of things we burn can vary from place to place. There are also some natural sources of air pollution, for example, dust, which is very common in certain parts of the world. But if we look at the global scale across countries and cities and neighborhoods, some of the most common ways in which air pollution occurs is through sources like transportation, so vehicles that are going from place A to place B and are using often gasoline or diesel in some cases because of fuel that people are using in their homes, either to cook or to heat. And in many parts of the world, especially in Asia and in Africa, people do not have access to electricity. They do not have access to natural gas. So often they're burning wood, they're burning animal dung, they're burning coal or charcoal to cook food or to heat water or just to, stay warm. So that's another major source of air pollution at the global scale. We don't really see that as a big source in North America or in parts of Europe, but in other places it is a big source. Another big source is energy generation. So whether we are producing energy through coal, whether we are producing energy through natural gas, we are producing some amount of air pollution. And then industries, which are widespread and often emit pollution into the environment. And then finally, one source which is more common in certain parts of the world is waste burning. So in places where there aren't efficient waste management systems, we often see that people burn waste in order to manage it. And that can also be a big contributor to air pollution.
So many sources, it sounds like there's not one simple solution or answer there, but many sources in many different places. And in terms of what our global leaders are saying, how would you sort of, it's a tough question, but how would you sort of summarize what the current conversation around air pollution is? Is this, I know you're saying it's not a new conversation or a new phenomenon, but what are our global leaders saying about it?
Yeah, this is an interesting question because in the last, I would say, decade, the conversation on air pollution has changed quite a lot.
Okay.
And it is actually receiving a lot of attention, both at the global scale and in countries at the moment. And there's a few reasons for that. Partly, we've seen that the health impacts of air pollution are pretty stark. So, according to one estimate based on a report we launched recently, just in the year 2021, almost 8 million people died as a result of exposure to air pollution in a single year. So those are really, really big numbers. And those are people that died as a result of air pollution. There are many more, both adults and children, who live with diseases for long periods of time. That means they may not be able to work, they may not be able to go to school, and they're not productively contributing to the society.
Mm-hmm.
We see huge economic impacts as well. So, in the last few years in particular, we have seen a lot of uptake on the issue of air pollution in terms of trying to reduce it so that we can see cleaner air, bluer skies. One of the, perhaps like not unintended consequences of the early stages of the COVID pandemic, although we were all living with so much uncertainty and fear at the time about what COVID might do, what it might bring, there were places where people were able to see blue skies for the first time in their lives because
Yeah.
they had never been in a situation where the blue sky was visible from their balcony or from their home.
Mhm.
And that was another moment where a lot of people thought, well, this is something that can be solved if we, decide to focus on it. And just this year, a few months ago, there was a global resolution passed by the UN Environment Assembly to enable more regional cooperation in order to address air pollution in a better way, to work together in partnership across countries around the world. And in fact, tomorrow happens to be the International Day for Clean Air and Blue Skies.
Wonderful.
Um, this is a day that commemorates our interest in seeing blue skies everywhere in the world. And this is the fourth year that this day is being celebrated. So many ways in which people are both recognizing air pollution as an important issue that we need to deal with globally and also looking for specific solutions that will help us get there.
Thank you for bringing awareness to tomorrow. That's wonderful timing to have you join us here today. And a lot of what we've been saying just now is sort of blue skies being an indicator of air pollution. But at a global level, can you speak a bit more on how air pollution is measured and monitored?
Yes. So traditionally, over many, many decades, the way that we monitored air pollution was through what we call reference grade equipment. In its simplest form, if we take away all the sophistication, we're essentially trying to draw in air using pumps. And we place filters that can collect some of the particles. Then we take those filters to the labs and we can do all kinds of measurements on them. This is how historically we've measured air pollution in different places. In the last 2 decades, we've seen a lot of advancements in how air pollution is measured. So now we have data sets that are derived using satellites that are doing measurements all around the world all the time. So we are able to see what the air pollution levels might be in a particular location in very close to real time. We also have very sophisticated instruments now that allow us to check air quality almost every second, every minute, every hour, depending on what we are interested in. And in the last few years, the availability of smaller sensors that you can walk around with, keep in your home, that tend to be a little bit cheaper, can give you an indication of what the air pollution levels might be, have also really expanded. So we've seen a lot of community and individual level engagement in trying to measure air quality, make decisions based on that. So at this point, I would say it's a variety of methods, the more traditional and conventional methods that are also used by regulatory agencies, methods like satellite data, which can give us a lot of information across time and also for a large part of the world, even in places where the traditional methods do not exist. And then finally, the lower cost samplers that we can place in our homes, in our offices, or carry around with us that tell us on a very instantaneous basis what the levels of air pollution are at any given time.
Thank you for expanding on that. It sounds like it's a bit of a complex process, but good to know that there are measurements in place. In terms of what areas of society are impacted, could you speak a bit more on what sectors or areas of society are impacted most by air pollution and how might they collaborate together to address it?
Yeah, that's another really good question because although air pollution affects us all, we always say it doesn't matter where you live and it doesn't matter whether you're rich or you're poor, you're old or you're young, you will see some way in which air pollution will impact you. We also know that certain sections of our society tend to be more impacted by air pollution. So that includes the youngest among us, children, the newborns when they are getting exposed to air pollution, often it means that as their bodies are developing and growing, they may not experience the same healthy growth that you would in the absence of air pollution or in places where air pollution levels are lower. We also see that pregnant women or pregnant people can be really impacted by air pollution. A, because it will impact their own health, but B, also because through them, their growing babies can get exposed to air pollution, resulting in health effects for them. And then we also have significant impacts on older people who may have lived with air pollution exposures for long periods of time. I think we're going to talk a little bit more about it. But in addition to these population types within the society, there are also certain, types of people, certain types of occupations that may mean people are getting more exposed to air pollution. For instance, in many countries, especially in low and middle income countries, we've seen evidence that people that work outdoors, so street vendors, which tend to be very common in many countries, traffic police officers who are standing outdoors in many places manning traffic and helping ensure smooth traffic flow can get exposed to really high levels of air pollution. And more recently, in the US, where I'm based right now, we've seen that with wildfire episodes that tend to be happening with a much higher frequency, people that are living closer to those areas, but also all the firefighters who are going in to try and control the fires, are getting exposed to really high levels of air pollution. So there's one section of our society which is more age-based, and that includes the youngest and the oldest. But there's also another way of thinking about it, which is what occupations do people have? What part of the cities do they live in? Because sometimes people that are, lower income neighborhoods, people living in lower income neighborhoods may get higher exposures to air pollution because there may be more polluting sources located closer to them. So that's another way in which air pollution can be higher for certain parts of our population.
Thank you for clarifying that, and we'll certainly touch more on the aging component on it as our conversation unfolds. In terms of what we see in addressing climate change, or sorry, not climate change as much, but air pollution, do we see much conversations between professions that are impacted, or do we see much collaboration on how to sort of attack or prevent air pollution at this point?
Yeah, that's another area that is growing and developing. I think we've all seen the role that medical professionals in particular can play in getting people aware and engaged around, any topic. And in the last few years, we've seen very interesting and very powerful examples of doctors getting involved in conversations on air pollution, not just talking to their patients about it, but also in thinking about, what systemic changes need to happen, and how the medical fraternity and the healthcare fraternity can get involved in the conversation. Some doctors have set up special chapters so that they can get other doctors involved, and nurses and midwives and all kinds of healthcare professionals involved. So we're seeing a lot of engagement there. We are also seeing people that work in what would, conventionally be considered other sectors like urban planning or city design, or transportation planning, now starting to work with air quality experts and air quality professionals to try and imagine, how should the city get designed, how should certain plans be implemented so that we can reduce environmental exposures, especially air pollution, but also things like noise. So we are seeing more collaboration to an extent, but there is really opportunity for a lot more still to be done.
That's very interesting. And at the IFA, we're quite familiar with the age-friendly environment framework and creating age-friendly cities and communities. So it'd be interesting also to explore how air pollution is considered in a component for creating cities that are suitable for older adults and aging populations. So that's something I will definitely keep in mind as I continue my own work on age-friendly cities and communities. Um, yeah, so I think turning more towards the direct impacts on older populations, and now that we've learned a bit more about the impact of air pollution, how are older populations specifically impacted, and why is this a population of special concern?
Great question. And there's lots to discuss here. So there's a couple of things to start with. One is when we get exposed to air pollution, it can impact us in two ways. So often there can be acute exposures or exposures that happen for a very short window of time, a few hours to a few days, and those can result in some health impacts. Some of those health impacts are very reversible. So, for instance, if I'm in the middle of a very busy road and there's high pollution, I might experience, watering in my eyes. I might feel like coughing. But as soon as I'm away from that environment, I feel fine. I feel okay. And I have been in many instances like that. What we know from scientific studies over the last 3 decades or more is that what the biggest impacts of air pollution are coming from long-term exposures. So exposures that are happening over months and years of our life. What that also means is that as we get exposed to air pollution over long periods of time, we might develop certain diseases. We might be at a higher risk for certain types of diseases. And some of those effects manifest later in life. So we are getting exposed to air pollution and we're living through it. We're not seeing any immediate effects. But then, we might be diagnosed with chronic diseases. We might experience symptoms that are harder to manage. And we see the biggest health effects or the biggest health impacts happen in adults beyond the ages of 60. Also, as we get older, we tend to become more susceptible to infections and other diseases. So it's a combination of factors. We're getting exposed to air pollution for long periods of time, and we are starting to get to an age where some of those effects will start to show. And the types of diseases that are most commonly associated with air pollution, including lung diseases as well as others, tend to be more prevalent in adults. So it's that combination of factors, which means that our older people, older populations are at a higher risk of health effects.
That makes sense. Definitely see how those two are connected a bit more clearly now. And in terms of diseases that, are typically more present in older adults or are further impacted by air pollution, could you detail sort of what parts of the body or what areas and what functions are impacted by air pollution most specifically?
Yeah, so often when I talk to people about air pollution and how it affects their health, the most common type of disease that people think of is something to do with our lungs, which makes sense because we're breathing in the air, it's going into our lungs, and we all would agree that it would impact our lungs. The worrying thing is that over the course of, again, like the last 2 or 3 decades, we've seen evidence, very consistent evidence across countries and across regions of the world, that air pollution isn't just impacting our respiratory system or our lungs. Of course, our lungs are getting impacted. We see respiratory infections, we see cases of asthma, cases of new asthma, as well as people that may be living with asthma getting asthma exacerbations. We see cases of chronic obstructive pulmonary disorder or COPD more commonly, which is a chronic respiratory disease. But the biggest health effects of air pollution in adults are actually related to cardiovascular or heart health. So we see cases of heart disease, cases of stroke, angina, heart attacks related to air pollution exposures. We also have found evidence that air pollution exposures are linked to certain types of cancers, especially lung cancer, and other non communicable chronic diseases such as diabetes. So, those are some of the health effects for which we have a lot of evidence, a lot of data from many different parts of the world. In addition, we have started to see very strong evidence in recent years on the impact of air pollution on our brain health. So, in younger children, it might mean, lower IQ or test scores, cognitive test scores. It might mean lower attention spans in children, or diseases linked to the attention, deficit disorder. But in older adults, we have seen very strong evidence also of exposure to air pollution being linked to diseases like dementia and Alzheimer's, which, of course, are becoming very common and prevalent in general in societies around the world, but also that air pollution may be contributing to some proportion of that.
It's very interesting, and that's definitely not something that I typically hear in the media of that connection. I think that answers or that comes up to one of our audience members' questions here. We have an audience member, Shmuel, who is a regular attendee to our Global Cafe, and he has the question: what impacts of air pollution on mental health and cognition of aging populations around the world?
Yeah, so I think, we definitely have evidence now on the impacts related to diseases like dementia, Alzheimer's. We also know that exposure to air pollution, and this is really the growing evidence base, so we hope to continue to learn more, that exposure to air pollution might result in symptoms related to depression. And also, intuitively, if we think about it, when we live in high pollution environments, and we're not able to see, we're not able to see the blue skies, and we're not able to really experience our environment in a good way. We tend to not feel well. Like even when it's rainy and gray outdoors, we just feel a little low in energy in general. At least that happens to me, especially during winter time.
Me too.
And living with that kind of environment and getting exposed to the pollution, we have seen evidence in multiple countries now that people might experience depressive symptoms, so clearly related to air pollution exposures. And definitely a huge health burden is linked to the neurodegenerative diseases, especially dementia.
Very interesting. And from your knowledge, would you say that there is much advocacy going on in sort of the mental health or brain health spaces regarding the impacts of air pollution, or is that um, sort of too new of a link that's been made where there's not as much advocacy yet?
Yeah, so I would say that it's definitely at very early stages. We have seen this evidence in the last few years. So it is a new area where there are still a lot of questions around, how exactly this is happening. How is as we get exposed to air pollution, how is it really impacting our brain health? But we
Mhm.
do know enough now to say that there is a credible link. And there are some institutions that are starting to think more actively about air pollution and mental health and brain health,
Mhm.
including the Global Mental Health Action Network,
Okay.
which is trying to bring air pollution more strongly into the mental health and brain health conversations. And even in the global negotiations that happen, they're trying to ensure that the impacts on mental health and the impacts on brain health are considered just as we would consider cardiovascular effects or respiratory effects. So it's starting to grow, but I would say it's at a very early stage. And hopefully, some of the folks on this call here can also become advocates around that
Yeah,
topic.
that would be wonderful. And our one of our attendees has a question, a follow-up question to the conversation on dementia. Megan, if you're here with us, do you want to unmute to ask your question?
Hiya. I was just going to ask, so how you said that dementia links to the pollution. What investigations, like scientifically, would you have to do to test that? I'm just interested in like how you'd even find out that there's a link to dementia.
That's a great question. And this is actually a question that comes up in a lot of contexts and a lot of conversations. So often, and of course, we know that there are a variety of factors that could be impacting how diseases happen in humans. So there's a few different ways we can study it. One way is to look at large populations, large sets of people, large groups of people, often, using what we call epidemiology studies. So we would look at, hundreds or thousands, or now actually people are using millions of people, and looking at air pollution exposure for those individuals, looking at their health history and their health statistics, and then trying to control for any other factors that may be contributing to those same diseases. For example, with many of the diseases I mentioned earlier, smoking is known to be an important risk factor, especially for respiratory and also for some cardiovascular health effects. So often, with these large scale studies where you look at data from lots and lots of people, and then you try and control using statistical methods what might be the effect from other risk factors, or what might be the effect from, just age and some of the nutritional benchmarks, you can come up with what is the additive or additional effect that air pollution has. A second way that people study some of these links is through studies in the laboratory. So you can look at cell systems that replicate what's happening in our bodies, and then you can expose it to certain types of air pollution or different levels of air pollution and see how the cell systems behave. Sometimes there are studies also done with animal models so that we can understand the mechanism, because it is not enough for us to know, yes, we're seeing in large studies with lots of people, we're seeing these connections between air pollution and dementia or any other disease. We also are very interested in understanding how is that happening? what might be the mechanism. And one of the ways in which we've understood generally how air pollution affects our health is through targeting, our inflammation pathways. So when we get exposed to air pollution, when we breathe in air pollution, we can experience inflammation. And it can cause oxidative stress inside our body, which can then dysregulate some of the normal processes that happen. So, in trying to understand the links between pollution and dementia, but also between pollution and other diseases, we often tend to try and do a combination of these types of studies. So, can we follow large groups of people? There are now studies that have looked at people over 20, 30 years as they've grown older, in some cases, as they've gone from being born to becoming young children, becoming adolescents, becoming youth. And over the course of that time, you continue to see what levels of air pollution they're getting exposed to, and also, what other factors are out there that may be impacting those health effects. We combine that kind of knowledge with what might be studied within the lab using animal models or using just cellular models. Now we have, a organ system on a plate kind of models available now that you can do your tests with. So it's a combination of all of those things that then allows us to determine what these linkages might be.
Thank you, Dr. Pant, and hopefully that helped to answer your question a bit as well, Megan. And just catching up on some of our questions in the chat here. Oh, good. Glad that helped you out, Megan. One of our guests again, Shmuel, has another question. What do we need to do to reduce the adverse effects of air pollution on older adults, specifically those from poor or low socioeconomic groups?
Yeah, that's an important question, and also I would say a somewhat tricky question, because there are a couple of different ways that we can intervene. So, of course, at a personal level, we can think about strategies that will reduce our exposure to air pollution. In some cases, that might mean that if air pollution levels are high in your location, avoid going outdoors or avoid doing physical activity. So if you would normally always go for a walk 7 in the morning and you see that today air pollution levels are a little bit higher, maybe don't go out at that time. Maybe you can go a little bit later in the day when the pollution levels may have come down. In some instances, people also deploy strategies like finding lower exposure routes. So if I want to go for a walk or if I want to go cycle outside, I try and look for small roads that won't have a lot of busy traffic so that I can be away from that traffic. In some cases, people have effectively used air purifiers in their homes to try and reduce their exposures while they're indoors, especially if they have people that may be living with chronic diseases, because we want to minimize their exposures as much as possible. Now we are also seeing for some locations, especially in the US, during the wildfire season, we have these clean air zones, which are essentially, rooms that you can designate in libraries, etc., where people can go and minimize their exposure. So that's one level of risk reduction or exposure reduction that we can practice ourselves to the extent possible. I will also add that for many, many people, especially in low and middle income countries, none of this is possible because they need to be outdoors, they need to be working, they can't afford air purifiers, they can't afford not being outdoors at certain times of the day. So there's a little bit of a mismatch between what we can truly do to reduce our exposures at a personal level, depending on what resources we have access to. But at the level of the government and what governments can do, we've seen very strongly across the world that reducing emissions at source will improve air quality. We've seen that happen in the US over the last 3 decades and more, and we've actually seen very impressive declines in air pollution levels across the continental United States. Mm. At the same time, we have not seen, the economic opportunity go away. So US has been a good example to showcase that you can do both. In more recent times, especially in the last 10 years, We've seen the same thing happen in China. They have dramatically reduced air pollution levels by controlling sources, by going after sources that are the most polluting, by reducing emissions from that sources, putting strong regulations and curbs on them. And more recently in the US, the other interesting development and helpful development has been the idea that we are now looking more carefully at communities that may be at a higher risk of both exposure to air pollution and the impacts from them. There have been a variety of environmental justice initiatives that the US government has undertaken, which are aimed at either trying to understand better where the air pollution problems are or trying to co-create solutions with the communities so that we are coming up with strategies that will be useful in the long run. So I think there's a variety of things that we could be thinking about.
Okay, thank you for elaborating on that, and hopefully that also answered Shmuel's inquiry there. In terms of what the individual can do when they're leaving their house and wanting to mitigate their exposure to air pollution, is it so much as knowing sort of what routes to avoid or avoiding areas that you can visibly see that have high air pollution, or is there any sort of monitoring way, say on a website or an app that folks can tune into? Do our weather apps say so much now or not quite yet?
So I would say it depends on what part of the world you live in. In many countries, you can get very consistent and regular air quality updates through either the weather app or there are specific apps that tell you about air pollution levels. If you're in the US, Air Now is a great resource. It is a resource that is run by the Environmental Protection Agency, and it has information on air quality levels for all parts of the country. So you can also get alerts when there's going to be a high pollution day in your city. For other countries, there are again apps. So if you try and search online or if you just look on the app store on your mobile phone, you will find an app that will give you an air quality number for your city. That's progress that we have made in the last few years. And yes, I would say if you are interested in trying to reduce your exposure to air pollution in general, try and be, proactive to see what is the level of air pollution. Should I be outdoors or not? And many countries now also give information on not just the level of air pollution, but who might be at risk. And they often have health advisories together with the air pollution information, often in the form of what's called an air quality index. So it tells us who might be at risk and if you feel like you are in that category, or if you're generally trying to reduce exposures, avoid especially physical activity during periods of high pollution. Also, if you are someone who likes to cook in your home with electricity or gas while you're cooking, ensure that you're ventilating your home really well, because it's not just the traffic and the energy sources that are causing air pollution. Even when we cook food, we tend to produce some level of air pollution. With the use of ventilators, opening windows, we can minimize that. So try and practice that. Same thing goes with use of things like candles in homes. Often we like to use candles to get a more cozy environment within our home, or use incense sticks. If you are doing it, open your windows, ensure there's ventilation, or try and minimize those so that you are not getting exposed to it. And if you or a loved one has, some chronic condition, then air purifiers used in a good way can help reduce exposure, at least while you're in your home.
That's very interesting on bringing awareness to candles and home cooking. That is definitely something I personally would have never considered to be something to be mindful of. So it's very interesting. And thank you, Bernice, for adding some of these resources that Dr. Pant is talking about in the chat there. So those are welcome to be checked out as well by other attendees. I want to loop back around to a part of our conversation that I'd like to expand on a bit more from earlier. We're talking on how you can be sure that air pollution is the cause or the impact on some of the diseases we have. I would like to build upon that, and maybe you have a bit more insight on cause of death specifically, how we can track and monitor that air pollution is the cause of death, and how we know that 8 million number is accurate.
Yeah, excellent question. And again, I would say a question that comes up very often. In fact, in some instances, people also ask, like, how do you know 8 million people died because of air pollution? Since no death certificate would say air pollution was the cause of death. So I want to start with a story of a girl who actually did have air pollution listed on her death certificate. This was a 9-year-old girl named Ella who lived in London and had asthma. And she lived, close to a busy roadway in London, got exposed to air pollution over the course of her life, and unfortunately died at the age of 9. After her death, there was an inquest in the UK, and the doctors actually did, share that air pollution was a contributor or the cause of death for her. This is perhaps the only case in the world, at least that I'm familiar with, where air pollution got listed as a cause of death. But the reason we are able to come up with these numbers, like the 8 million number that I spoke about earlier, is because we have a lot of evidence over the last 2, 3, 4 decades that gives us a good understanding of how exposure to air pollution at different levels results in health effects. And we've been able to combine that knowledge and that information with information on what levels of air pollution are people getting exposed to, at what rate are people dying in every country around the world, at what rate are people experiencing chronic diseases like heart diseases or lung cancers. So we are able to combine all of those different types of data sets and knowledge to come up with these estimates. And the argument is also true in case of smoking. We all know and we all would probably agree that smoking kills. But you would never see on any death certificate that the cause of death was smoking. The cause of death would often be lung cancer, it would be some kind of heart disease, some kind of respiratory disease. So, in the same way that we've been able to learn a lot about how smoking affects people's health and then apply that knowledge to understand the impacts of smoking, we've been able to study a lot about air pollution, and we are now able to apply that knowledge, even if the cause of death on a death certificate is not necessarily air pollution.
Okay, that makes sense, the distinction there. So thank you for bringing that up. And it is certainly a very interesting area where we're coming to terms with new information here as well. Just gonna pop into the chat with some questions here. We have one from Matali that says, how can we involve older adults in processes for advocating improvements for air pollution?
Good question. Again, I think a lot of our uh, efforts on air pollution have focused on children, which, understandably makes sense. We want children to be healthy and thriving. But we also know that in many countries now, the populations are getting older. So we are going to have more older people in most parts of the world over the next 2 or 3 decades. And as we discussed earlier, we also know that those are the parts of our society that are going to perhaps be more impacted by air pollution in the long run. So, in terms of engaging older adults, I think, at least from what I understand, even starting conversations around aging and air pollution and how those are connected and what might be the impacts on older people. I think we've not had those really broad conversations to the extent that would also give people a glance into the variety of ways in which air pollution is connected to poor health in older adults. So I would start with more conversations like this one where we can talk about these issues, and also, there is plenty of data and information out there. Perhaps organizations like IFA can, consolidate some of it so that people who may be interested in advocacy and engagement around this topic have good talking points and good information that they can utilize. That's what's been done to an extent in the climate change conversation, creating the right sets of data, right sets of, talking points. So I would go to those types of methods. And then finally, I think in a broader sense, I still feel we need to, integrate some of these principles into how we think about our cities, our living environments, because air pollution also is not a standalone problem. Unfortunately, it is also not a problem that can be solved just by the air quality community. We're going to need a lot of engagement from a lot of different people. And, just like doctors talking to their patients about, air pollution, just like they would talk about diet or physical activity. Similarly, governments promoting and sharing information. And then for older adults, I would say, let's create more resources and also let's create more opportunities so that we can talk about what these, wide variety of health effects are.
Thank you. It's interesting how many causes really come down to increasing intergenerational dialogue as well, and increasing awareness through all generations. And another question that's following up here, we touched a bit on the barriers already, but is there any additional comments that maybe we didn't touch on that comes to mind when thinking about some of the common barriers older adults and vulnerable populations face in participating and advocating for the awareness of issues like environmental pollution?
Yeah, so this is an interesting question also because in some instances, and especially I will say in low and middle income countries, we see that the vulnerable populations are often the most disenfranchised populations. They have very little space and power to actually advocate for issues that are of relevance to them, and decisions get made on their behalf in many cases. So there's definitely barriers around access and who are we able to influence on a particular topic, especially on things like air pollution, which can sometimes be very controversial or can be deemed very controversial. um, and I would say that in addition to the fact that, at least from my perspective, I feel like a lot of the conversations we have around air pollution and around who's vulnerable and who's impacted often tend to happen either in spaces or in languages that are not as accessible for people. So if you're going to have a discussion, in a fancy ballroom, who's going to be there and who's not going to be there, importantly. So probably some of the more, practical barriers that perhaps face a lot of our other topics as well. But some of it, I would say, is probably lack of knowledge translation in a way that information is accessible to people and they can use it and they can, then work with it in their engagement and advocacy efforts.
Mhm. And this question from another audience member is in connection to what we're speaking of here now. And I think I'm curious a bit more about the framing of air pollution as an inevitability or the cause of it. And Carly here asks, are Indigenous populations differently impacted by air pollution? If yes, do you know of any current initiatives or approaches that are currently being employed to address these specific populations?
Yes, so indigenous populations also, in some cases, get exposed to higher levels of air pollution and higher levels of pollution in general, I would say, including air pollution. In the US and in Canada as well, we have seen that in some instances, indigenous populations do have higher exposures and also fewer monitoring efforts. So we know sometimes less about what the air pollution levels might be in those communities. There are initiatives that are being developed or that have been implemented in recent years, at least in the US. I can speak to it as part of the larger environmental justice and community health efforts, both to try and improve what we know about air quality in those communities, to engage them in monitoring air quality and in co-creating solutions. So there's still a long way to go. Historically, we've seen indigenous populations are not as central in a lot of the conversations. That has been true also in case of air pollution. But we're starting to see some shifts in that. And in other places or in certain other countries, I would say the indigenous populations are at a much higher risk, also because they tend to, be in areas that may have higher pollution levels or in areas where um, pollution sources tend to get cited. So it's
Right.
a really different story across different locations.
Mhm. Thank you for answering that, and hopefully that addressed Carly's inquiry a bit more there as well. As we're running close to the end of our conversation here today, I want to ensure that all of our attendees have their questions answered. So we're going to take a bit of a pivot from our current topic, but we have a comment here from a guest from Ireland, I believe. Eiley, do you want to unmute and
Yeah,
ask a question?
thank you very much, Elizabeth. Yes, it is Eileen. Thank you very much for a great talk and conversation. I don't really have a detailed scientific background. I only have it at a ladybird type of level. I'm just interested in when you triggered me to search for the air pollution in Dublin. I'm from Dublin, and I'm seeing MM 2.5 and PM 10. I'm assuming they're sort of micro things coming from the fuel and wood and things like that, and they get into the body. But what does it actually mean? In other words, how do there is a graph which says it's at a certain level, but is that saying to me, don't go into the center of the city now today? And, 3 times the word, the WHO air quality guideline. What does that mean?
Mm-hmm. Yeah, that's an excellent question. Thank you so much for looking this information up so quickly and then also asking this question. So PM 2.5 is essentially PM stands for particulate matter. And so that's in common language, that would be fine particles. And the 2.5 and the 10 designate the size of the particles. So 2.5 means that the particles are going to be smaller than or equal to 2.5 microns, not visible to our eye. PM10 means they will be particles that are equal to or smaller than 10 microns. Again, not really visible to our eye. So they're very, very tiny, tiny particles. And usually every country, or most countries, I should say, not every country, has set their own air quality standard. So they would have a limit that they think PM 2.5 should be over a 24-hour period or over the course of the whole year if you average it out. And when countries talk about their air quality, they often use these air quality standards as the benchmark. The World Health Organization, or WHO, also from time to time comes up with its own guidelines on air quality levels. These guidelines are based primarily on health data, so studies like the epidemiology studies I talked about earlier, toxicology studies, etc. And they in their most recent update, which was in 2021, set the PM 2.5 guideline to be 5 micrograms, which is why you're probably seeing concentrations in Dublin currently about 3 times higher. So the concentration is probably around 15. Am I doing the math right? Around somewhere between 15 and 18 micrograms is probably what you're seeing. I will say, not to alarm everyone, the guideline value that the WHO has set is relatively low. The lowest air quality standard that any country has set is in the US right now, and it's at 9 micrograms. And there are very few places where we can actually see levels that are at 5. So my personal, suggestion would be, if you're seeing levels that are between 5 to 15, 18, they're still high, but probably okay for you to continue your activities. And this is just my personal opinion based on what I think the risk is probably going to be okay for, especially if you're just going out for a little bit and then coming back home. If you see levels that are even higher, going above 25 or so, maybe exercise more caution. And in some cases in winter, probably in Dublin, still there are wood heaters that are used during winter time. So those might be the times when you really want to monitor what the air quality levels are and whether you should be outdoors for very long. Because I mean, we also have to be practical, and I try to be practical whenever possible. We can't stop all activity just because there's air pollution outside. So we can just try and make as informed choices as possible when possible so that we can reduce our exposures.
Wonderful, thank you. And I think that did a good job of addressing Eileen's question there. Unfortunately, our time is closely wrapping up here. We've had a wonderful discussion here today. We're coming to a close to the end, but I would really love to hear your key takeaways from today's discussion. But just to give you a moment to sort of gather your thoughts on your last concluding points, I would like to introduce our speaker and topic for next week. So please join the IFA during our next discussion in conversation with Professor Patrice Forget on the topic of the impact of pain and aging in populations as a part of IFA's new three-part pain management series. So we're very excited to get started on the pain management series and look forward to seeing you all next week for that. Now back to you, Dr. Pant. Could you share your key takeaway messages for our audience here today?
Yeah, I think I'll say three things. One, air pollution is a problem in many parts of the world. So hopefully we can see engagement from all of you and some advocacy around it. B, air pollution is definitely impacting our older populations more. So if you find ways to promote the need to address air pollution within your communities or even within your friends and family, I think we need as many people aware about this issue as possible, and not just thinking about air pollution as a respiratory health issue or a lung issue, but really an issue that impacts our entire bodies. And then third, despite some very alarming data and figures that I showed and shared with you here today, we have seen tremendous progress in the last 3 decades on air pollution. So we are on a good path. We just need to stay on it and make responsible choices. So to end on that more positive note, with tomorrow being the clean air day, we are seeing progress in small ways in some places and big ways in others, but we're on that path that we need to stay on, and we need all of you engaged in order to get there.
Thank you so much for that, Dr. Pant, and thank you for being so generous with your time with us here today. I think our conversation has really highlighted the importance of ensuring that nobody is left behind, including older adults, and really showing that connection between the impact of air pollution and aging populations. So before we sign off, I would also like to again thank everyone for another great week of our Global Cafe. And with a dedicated thanks to the incredible people working at the IFA who have supported this, and every Global Cafe, in particular Bernice, who makes all of this happen behind the scenes. So thank you all very much for your time here today, and we hope to see you next Friday. Have a wonderful weekend and take care.
Thank you very much. Thank you.
Thank you.